Okay, it's Dr. Buford. We're just getting started on the right shoulder. We're looking in from the back to the front. You're laying on your side, and everything that we see is magnified 30 or 40 times on the screen. We've got a clear cannula coming in the front. This is a part of the shoulder called the rotator interval. To the left of it is the long head of the biceps tendon. We can look as it inserts down into the superior glenoid, and that insertion looks great. Sometimes if there's a problem down at the tip of that cannula where the long head of the biceps inserts, it's called a slap lesion, but you do not have that. We're going to rotate and look up at the rotator cuff because I'm too curious. I want to know now. And it looks like the articular side of the cuff is good. And so we were concerned that with this imaging that we had before surgery that you might have a bursal-sided tear from an acromial spur, and we'll see if that's the case. But at least on the articular side, that looks pretty good. That's a normal insertion of the rotator cuff. We're going to swing around and look at the back of the shoulder. Here's posterior capsule. Posterior labrum looks good. Your ligaments are relatively lax, but that's the way you've been your whole life. That's normal for you. You're not having any significant instability. And then as we look down the front of the shoulder, the anterior labrum and the anterior band of the inferior glenohumeral ligament both look good. So I don't see any significant problems at first glance inside the joint here. And that's a really good finding. So we're going to keep looking around just to make sure, but I'm going to go off on the video for the moment. Okay, so you remember how we looked at the rotator cuff on the undersurface, on the articular side. Well, now we're up above on the bursal side, which is kind of the superior surface of the cuff. And just like we expected to find, we've got this tear here. See this? This is a bursal-sided rotator cuff tear, and that happens quite often when there's a large bone spur that pushes on that part of the rotator cuff. And so as we rotate the camera here, and I rotate your arm, that's the tear. There's kind of a clear cannula in the way right there. We'll just move that back a little bit. But that's the tear. And now your bone spur that's been causing that problem is right there at the top of the screen. And I'll put in another instrument that I can use it as a pointer. This is the tip of the acromion right here, and it's this acromion right there that can push on the rotator cuff right here and create this tear, particularly as you start to raise your arm up. So the first step for us right now is to go ahead and remove this bone so that can't happen anymore. A little bit of a acromioplasty is what we call it. We'll get that done in just a minute. Let's put the burr on. Okay, so here is the burr coming in. And this is how we decide how much to take. Starting from the back of your shoulder, we just slowly advance forward. And you can see how for such a petite shoulder, you've got a pretty good sized spur here. We take this all the way over to the clavicle, which will be over here. We'll show you that more in a minute. And this is the amount of bone that we're removing here at the front of the shoulder. We make sure we get all the way lateral. And now that we've done that, you can see there's a lot more room in the front of the shoulder. See how now there's all this extra space? That spur that used to hang down to about here is now gone. This is your clavicle. I like to sweep underneath it just to make sure that there's nothing that can pinch on the rotator cuff underneath this bone either. And I think that's fine. So we're going to go off on the video for a minute, and now we're going to look and see how much of this tendon is torn here. Okay, let's put the shaver back on. So you can see how with very little shaving we can see down into the joint. We can start to see that smooth articular surface back there. And so now we're just going to take away enough of this injured tissue so that we can get a nice healthy repair back down to the bone. Okay, so here's the tear. We're going to take a spinal needle and just check our angle. We want to get a good angle down into the bone here for our suture anchor. And that looks like a pretty good angle there. Maybe we can get a little bit more anterior here. We'll show you some more in just a minute here. But if we back the camera out of the way, then I think our angle is going to be someplace right around here. Something right about like that. That looks pretty good. So there's the articular margin. If we keep going down into that little tunnel there, that goes down into the joint. We're going to place our anchor and our implant, our rhodium implant, right about here. Okay, so what we've got here is a suture anchor down right in the mid portion of the tear. We're going to pass our rhodium implant right over that. We'll show you how we do that in just a minute. Okay, so we've got our rhodium implant down. We passed through it 3 separate times. So on the left, on the posterior side, is the solid blue. Then we've got the black and white, then the blue and white. The tear is right here. So we're going to kind of custom fit this rhodium implant into this tear. And we'll show you how we do that in just a minute. I just want to show you the implant initially is 2 centimeter by 2 centimeter. And it's going to sit back up in there once we're all said and done with it. Okay, I just want to give you kind of an interval update here. We've got 2 of the 3 sutures passed. You can see them going underneath, above the rhodium, but underneath the tendon here. We're about to pass this blue and white striped one. We've been kind of custom fitting our rhodium implant. That looks pretty good. We're going to be able to bring this tendon right over the top of it. And now we're going to take a suture hook coming in from the front of the shoulder to come through the cuff right about here at the tip of that gold instrument. Okay, so we're all done here. We've got a single anchor with 3 sutures passed. Our rhodium implant has been snugged down to the bone pretty securely. This is the back of your shoulder. Our decompression was done up here at the front. And again, our rhodium implant is tucked right on top of the tuberosity, right down there. So we're going to finish up here and get you back to the recovery room shortly, okay? Good luck to you now. Bye-bye.